you did mention that there are different sizes of fibroids. What causes the sizes? And secondly, are there different types of fibroids?
Yeah, usually they start small. So they can start a size that you cannot even see. And maybe the size of a rice, a piece of rice. And then keep growing. And then they can grow all the way to 10 centimeters, the size of a tennis ball, and even the size of a football, though that is again rare. And so you might see a lady who looks quite pregnant, but what she has is actually fibroids.
Okay.
Then also the location of the fibroid is important. Some of them are on the outside of the uterus, on the surface. Some are in the muscle, and some are within, where the baby would grow if there was a pregnancy. So all these types are present, and somebody may have all of them.
Somebody may have all of them.
Yeah.
All right, we'll take a call from Eve, who's in Ruiru. Good morning, Eve. Good morning, Eve.
Well, I'm 22 years old.
Yes, Eve.
Yeah, and I had some abdominal pain. It was for me sometime when I was 21. Well, and I have recurrent yeast infection. And then I think my grandma had it, so that relate on should I be for the family?
Okay.
Yeah.
All right, thank you, Eve. Then we have Catherine. Oh, okay, Catherine, we've lost that call. So there's Eve, who has recurrent yeast infections and painful periods.
Yeast infection is very common, and especially around the time of periods, some ladies would get yeast infection before the period or after the period. Some ladies, if they use antibiotics for something else, let's say a cough, they would get yeast infection.
Maybe for the benefit of somebody who may not know what that is, maybe they even have it, but they don't know what is a yeast infection.
Okay, yeast infection is usually a vaginal discharge. So a lady would get a discharge which is not the usual. It's not normal. Usually thick, usually whitish or cream, looks like yogurt, has that consistency of yogurt, and then can cause some itching around the vulva. So if a lady has that whitish, curdy-like discharge and itching, that is probably yeast.
Okay.
And I was just mentioning that some of the predisposing factors, like taking an antibiotic. Some lady may just have a toothache or a cough and is put on an antibiotic and would get yeast infection. In pregnancy, it's very common because of the hormone changes of pregnancy. So ladies who are pregnant have yeast infection a lot. And then some have yeast infection because of the period time. And so either before or after. So it's quite a common condition.
Does it have anything to do with hygiene? Can you get yeast infection out of hygiene issues?
Generally not. Generally, because the vagina cleans itself, and so usually as long as basically I don't think hygiene really would come in.
Would come in. All right. Now you did mention, or we did talk about the different sizes and the number of fibroids that one may have. Does it automatically play out that the smaller the fibroids, the safer you are, the smaller they are, maybe the less pain, so such that if your pain is a lot, you can assume or you can think that possibly your fibroids have grown and urgent attention is needed?
Oh, that's a very good question actually, because it's not the size of the fibroids. Generally it's the location, because you can have, a lady can have very huge fibroids but have no major symptoms, and many, while somebody else has few fibroids and small, but they are located within the uterine cavity where the baby is supposed to grow if there was a pregnancy. Because those ones would usually cause the bleeding to be heavier. Okay. Actually, the other thing I had not mentioned earlier is other symptoms which can occur is some ladies with fibroids have problems conceiving. So that is an issue. And some ladies also, when they conceive, can have a miscarriage because of fibroids. So they do interfere with pregnancy and the continuation of a pregnancy.
Does one having fibroids necessarily mean you cannot?
No.
conceive?
Many do conceive and have fibroids throughout the pregnancy and even deliver. So it doesn't mean that if you have fibroids you can't get pregnant.
Okay.
It's only that in some people it can prevent a pregnancy.
All right. Is surgery the only form of treatment that we have?
Mainly, though nowadays there are new techniques coming up. For example, there is some medication which can be injected through the blood vessels. A wire or a pipe is put through the thigh. A small cut is made in the thigh, and then a small pipe is put through the blood vessel in the thigh, and this goes all the way to the uterus. So they would have an X-ray so they can see where the uterus is, and then they just put that thread that pipe all the way to the uterus, to the blood vessels of the uterus. Then they inject that chemical, and that chemical blocks the blood vessels which are providing nutrition to the fibroid. And so since the fibroid is starved of nutrition, then it dies and then degenerates and comes out.
Okay.
So that is something which has come up
New
now.
technology that's being used. Okay, we'll go to the phone calls, and we have Yvonne in Kitengela. Good morning, Yvonne.
Good morning.
Yes, your question?
I have two questions. Okay, would multiple abortions or miscarriages cause fibroid? And secondly, does bad smell from the vagina mean that you have fibroid?
All right. Thank you, Yvonne, for your question.
Okay.
Or your questions, rather. Two questions there. Multiple abortions, can they cause fibroids?
No. It's actually the other way around. That fibroids, if somebody has many fibroids, they can cause a miscarriage. Not routinely, but they can. And so miscarriages cannot cause the fibroids. Yeah.
Okay. Then the second question is, does a bad smell from the vagina indicate evidence of fibroids?
Rarely, in that sometimes, as I had mentioned, some fibroids grow within the uterus and may come out into the vagina, the birth canal, and those can get infected. And if they're infected, then they can cause a bit of an odor and maybe some discharge as well.
All right. What are the other things that maybe would cause a bad smell from the vagina, especially if it's not hygienic?
Generally infection. If a lady has a bad smell with discharge, it's usually an infection. But having said that, some ladies are very sensitive, and so they always smell that, they think there's a smell. When they come for us to see, we check and we can't smell anything. So probably they're just a bit sensitive.
Okay, maybe psychological. It's interesting you say that, because we had a discussion just yesterday, and we were talking about body odor, and one of the things that came up is that there's some people who psychologically just imagine that they are always smelling. So maybe
and they think everyone else is smelling it.
Yes, and they think everybody else is smelling it, and of course that can deal a big blow to your confidence and just the way you operate. And how can that be treated, or is it just maybe through psychology?
Yeah, at times we give the benefit of the doubt and give some medications, but at times when you tell them, actually I can't smell anything, and reassure them, sometimes it helps.
Okay. All right, we have Jennifer here who's asking a question via Twitter, and Jennifer says from the time she was 18, she's now 28, she's had very, very painful and heavy periods. She's been to the doctors time and again and has had no solution so far. What could be the cause?
Usually again we would want to do an ultrasound and see, does she have fibroids? Probably not. And at times actually at that age you find there's nothing at all. You do an ultrasound and it comes back as normal. In that situation, what we sometimes do is put them on the family planning pill, the contraceptive pill, even schoolgirls, because when they have those periods they can't go to class for 3 or 4 days. And so when you give them the pill, it acts through the hormones and then first reduces the pain and even the amount of bleeding. And so there are some girls who really benefit from that.
Wow. Does one have to, especially for maybe like school-going girls, do you need consent for them to...
We usually write a note to the school, the headmistress or the school matron, to to say that these are for medicinal purposes, and so that it doesn't cause any trouble.
Doesn't cause any issues. Going back to the surgery of fibroids, once one has gone through surgery and they have been removed, are there chances they can recur?
If the procedure where we're just removing the fibroids alone, called myomectomy, in that procedure we're only removing the fibroids and leaving the uterus behind. There will be some fibroids which are developing and they are very small that cannot be seen. So with time again they would start growing. But why we don't remove the whole uterus is usually because this lady still wants to have children, or maybe doesn't have any children at all, and so it would be unfair to really remove the uterus, and so we just remove the fibroids alone.
All right, we have Lloyd in Donholm. Good morning, Lloyd.
Good morning, how are you?
I'm very fine, thank you, and thank you for calling. What's your question, Lloyd?
Yes, thank you. So now I really wanted to know the difference between the cyst
To know
and the
that?
fibroid. Difference between the cyst and the fibroid. Because in this case, my wife had a cyst with fibroid. So she went and she was operated back, and after like 6 months time, we went back to the hospital and we realized she had cyst again. So I don't know which is more dangerous, between the fibroid and the cyst.
All right. All right, thank you, Lloyd. Just keep watching. We're going to answer your question. We'll take another question from Millicent in Nakuru. Good morning, Millicent. Okay, asante kwa kupiga simu. Unaweza endelea na swali lako?
Mimi niko na swali nataka kuuliza. Niko
Millicent, nafikiri simu yako kuna vile ina dial. Hatukupati vizuri.
Iko sawa?
Okay, sawa, nakusikia sasa, endelea.
Nasema mimi nilikuwa na fibroid na blockage of tube. Nikafanyiwa operation mwezi wa pili.
Unaweza tafadhali weka volume ya TV yako chini?
Hata siko kwa TV.
Okay, sawa. Ulikuwa na fibroids?
Na wakasema kuna blockage of tube. Sasa nikafanyiwa operation mwezi wa pili. Sasa wakaniambia ningoje mpaka 6 months ndio ni conceive. Sasa tangu hiyo siku sijai conceive. Ninaona ni kama naenda kumaliza mwaka, na akasema naonanga kuna ndevu zenye zinatokea. So wanasema sijui hormonal balancing, sasa sijui ninaweza saidika aje.
Okay. Sawa. Asante, Millicent. All right, we'll start with Lloyd's question from Donholm, and Lloyd wanted to know the difference
between a fibroid and a cyst.
And a cyst.
Yeah, a cyst generally is a small or a growth within the ovary, which is usually a fluid collection within the ovary, and usually is also of different sizes. Usually very small, but if it starts growing big, it would cause a bit of discomfort, and generally would want to remove it because of the small risk of cancer. So in a young lady who is below 50, for example, if it goes more than 8 centimeters, then we would want to remove it. Most ladies would come with a cyst of 2 centimeters, 3 centimeters, and usually we reassure them and tell them that if we check in 3 months on ultrasound, we might find it's gone. And that is usually the case, so we just reassure them. It may cause a bit of irregularity in the periods because the ovary produces the hormones, but usually nothing significant. Of course, if the ovary is extremely large, then we'd have to remove it also. While, of course, the fibroid we've discussed is the growth now within the uterus itself.
Okay. There's also another question from Millicent in Nakuru. She had a blocked tube. It was removed, and she was told she would conceive in 6 months. She's now 1 year down and still trying. Still no conception.
Yeah. So it looks like she's being followed up to try and get a baby. One tube was blocked, so they probably tried to unblock it, and she may have had fibroids which were removed. It's not 100%, so that means that we'd follow up and see if check the hormones also, make sure they are fine, and if, of course, we also check the husband, the semen, make sure there is good sperm count, the sperms are moving well and can cause a pregnancy. we try artificial insemination, where we get the husband's sperm and put them into the uterus. Okay. If that doesn't work also, then we now go to test tube baby, which is now available in Kenya, or the IVF, in vitro fertilization, because sometimes when the tubes are damaged, it may not be possible to cause a pregnancy. And so we give time. Again, she's growing older. As somebody gets older, the fertility gets lower, and so we have to take steps so that we don't get run out of time. So in vitro fertilization or test tube baby is the last resort, which should be considered if all else has failed.
And how long should one maybe trying to conceive give themselves? Because I'm sure there are many factors that may cause you not to conceive at the point you're trying. How long? What kind of a period should somebody give in terms of trying? Then if you need to have a checkup.
Generally, we say a year, sometimes even 2 years, especially if it's a young couple. And we're assuming a couple who stay together. We nowadays have couples, one is staying in Nairobi, the other is in Mombasa. So they meet once a month or once in 2 months. Again, that doesn't work. So we assume it's a couple staying together, and we give them a year.
So in short, for those who are staying apart, they may still conceive, but it may take a longer period.
Yes.
Okay.
And because now you reduce the chances.
Right.
If you take 100 couples, about 20% will conceive every month. So some will conceive on the first month, others will conceive on the 12th month, and they're all okay. So we need to reassure them that there's no problem, because some people get married and 2 months later they're coming asking what's happening. But normally the way the body works is that it's about 20% chance of conceiving every month. And so after 1 year, there's no conception, then we would probably start thinking of investigating.
Okay. Susan in Nairobi. Good morning, Susan.
Good morning. How are you?
Very well, thank you. And how are you?
I'm very fine.
Excellent. To your question, Susan.
Yes, I'm a 53-year-old lady. I'm still receiving my period. So I've been trying so many family plannings, and they seem not to be working on me. So last year they did cutting the tubes.
Okay.
So that I cannot conceive. Then, but the problem is, every month nowadays, I get anytime it comes, they are very painful, especially on the first day. But on the second day, the third day, it's okay. But every first day of the month, the periods are very painful.
Okay, just as a matter of interest, Susan, you said that they're not working. When you say they're not working, is it that you conceive, or what happens?
No, I'm past conceiving age. I'm 53.
Okay.
Yes.
All right.
But because I'm still getting my period, I decided to go for the permanent family planning.
All right.
Yeah, so the tubes were blocked. They were cut. I don't know what they call. There's a name for that.
Tube ligation, I think.
Yes, exactly that.
Okay.
One. Yes.
All right. Thank you. Thank you very much, Susan. We also have Rose in Eldoret. Good morning, Rose.
Good morning.
Yes. Go right ahead with your question.
My name is.
Okay, Rose, I can't quite hear you.
You can't hear me?
Yes, and I can hear you.
Yes, I'm saying for 2 years, last week for 3 minutes. Yes, and I wanted to ask the.
I'm sorry, Rose, I can't hear the question. I don't know if that just try the question again.
I'm asking the family. If I've been with them for 7 years. Yes, and I wanted to ask the family if my teacher
I'm sorry, I can't hear what she's saying. We'll have to drop the call, and somebody maybe will try and call you and get the question. But maybe we can start with Susan's question, who's 53 years, and she's now on family planning.
Oh, yes, so she had a tubal ligation as a form of family planning, and still gets pain during the first day of her periods. I don't think it has anything to do with the tubal ligation, but she may have pain occurring for some other reason. And usually would try pain killers, because we are expecting that she should go into menopause soon. The average age being 50 years. So if she could try painkillers, which we can even use quite strong painkillers to stop the pain, and those should help. But we would also want to check that there's no other physical cause. We would want to do an ultrasound. Are there fibroids? Is there an issue with the ovaries? Are they twisted? And then is there a cyst? And then we'll deal with it accordingly.
Okay. Rose's question is that she had been using contraceptives for the last 7 years. She stopped using them in 2013. We're now in 2015, and still she has not been able to conceive. Is there hope for her? Okay,
it also depends on which type. For the injection or the Depo-Provera, there's what we call a delay in the return to fertility, meaning that when you stop it, it doesn't mean you're going to conceive immediately. Exactly.
Right.
While for the others, the pill, the coil, the no-plant, or the Jadel, which we put under the arm, all of them, once they are removed, the fertility comes back immediately. So we now go back to the 1-year trial. Since it's 2 years, then she needs to be checked. We need to see why she's not conceiving.
And her spouse as well.
Exactly.
Okay. And is there a risk factor when you use family planning methods of not conceiving later in life?
Not really. These are all reversible methods except the tubal ligation, which is irreversible. All of them are reversible. So it does not affect future fertility.
Okay. And with tube ligation, one may sometimes, I mean, it actually constitutes cutting the tube and, you know, sort of tying it up.
Yes,
and does that mean, or rather, there are some who may wonder whether you still get your periods because you know, you've literally blocked the passage.
Okay. Actually, the periods still come because the periods are just coming from the uterus itself. So all we are doing is blocking where the egg and the sperm were going to meet, but the periods go on as usual.
Go on as usual.
Yeah.
Okay. And now maybe as we summarize, because I see time is really moving on, maybe some of the things that people ought to know, especially ladies, in terms of fibroids. What are the telltale signs that I may have fibroids and I need to be checked, so that you avoid having them grow to a point where they're too big and then it becomes a more complicated issue?
Yeah. If a lady is if the periods suddenly start getting heavy, then she needs to be checked. On average, we also say if a lady is changing more than 5 pads in a day, that constitutes quite a heavy period, and she needs to be checked. Also, if she has any pain or pressure in the tummy, or she starts seeing that her tummy is growing, then she needs to be checked.
All right. Well, Dr. Sang, thank you so much. Sophia is on standby. Sophia, I don't know if we have answered all the questions. You know, I started by saying that it's interesting that we have 2 men talking about fibroids. Sophia.
It is indeed quite a sight to behold. 2 men talking about fibroids. But it reminds me of a while back when we had a conversation. I think it was about... trying to remember, something with childbirth, and we had the mortality rates actually, and we had the Secretary General, Kenya Red Cross, one of the UN officials. It was all men, and it was on purpose to show that, you know, it's a very important conversation and should be had by all, because I mean, there are children, these ladies, whether it's our mothers, our sisters, our wives, you know, all part of us. So it's good that we have the 2 men talking. And where can people find you if they don't contact you?
Okay, I would probably leave my contacts so they can call KTN, and then
maybe an email address.
And an email address.
Okay.
Yeah.
Oh, where are you situated?
Okay, I work for Kenyatta Hospital and MP Shah Hospital.
Kenyatta and MP Shah. So that is where they can find you. Well, thank you so much for joining us this morning. We appreciate
Thank you for having me.
You taking the time to be with us on Your Health. And that is Your Health this morning.